New treatment for MS patients who've tried everything and have yet to find something that works for them. It's not cheap, but it is providing new hope for patients who feel like they've run out of options. Here's health editor Dr. Maria Simbra.
Barbara Baird has had multiple sclerosis for 27 years.
I walk with a walker. I have walked with a cane. I've been in a wheelchair. I've been in bed. So I've had a lot of different symptoms.
It used to be there were no medications to treat it. Over the past 2 decades, about a dozen medicines have come along. She's tried them all to reduce the inflammation and to soothe the immune system. Now, a new medication, originally used for cancer, has been FDA approved for MS. It's called Lemtrada.
I'm hoping that this would be one that might work for me.
We've increasingly borrowed from other fields, cancer, rheumatoid arthritis. We just treated our first few patients in the last 2 weeks.
The drug targets and destroys certain types of inflammatory white blood cells before they get into the brain and spinal cord to do damage. Multiple sclerosis is an autoimmune disease where your own body attacks the coating on nerve endings in the brain and spinal cord. The nerves become like frayed wires and essentially short circuit. You can have numbness, weakness, vision trouble, balance problems, and other symptoms depending on which parts of the central nervous system are affected. In studies, Lemtrada decreases flare-ups of symptoms and the formation of new plaques, these scars seen on MRI scans.
This is the kind of drug you take when you've tried everything else.
The FDA recently approved the drug, though about a year earlier had rejected it. Advocacy groups pushed for approval.
I think the advocacy groups have a role to play as far as making sure that these drugs are looked at in a timely fashion. I don't think that the advocacy groups are going to sway the FDA in terms of approving a drug from a scientific standpoint or from a safety standpoint.
The safety concerns include 1 in 5 people developing thyroid problems, 1 in 50 having trouble with clotting cells called platelets, also kidney issues, and severe infections. Despite these concerns, the drug is approved in Europe. It is given by vein once a day for 5 days straight, then a 3-day treatment is given a year later. In the meantime, there's monthly blood work.
It's really high maintenance.
And there's the cost, $20,000 a vial. The drug company is footing the bill for Barbara's medicine, but there are additional expenses.
The infusion process will be where it's costing me money.
Barbara has high hopes to match.
That I won't have to use my walker, and that's my biggest hope. Because my son's 24, he might get married, and I don't want to have to go down in a walker. It's just not my thing.
Unfortunately, this is not a medicine that is going to be restorative for a patient that's already in a wheelchair for many years. It's not going to restore their nervous system.
Even so, she is willing to take the risks.
This is my last hope right now.
I'm Dr. Maria Simbra, Kdka TV News.
There could be a new tool to